First up tonight at 6 o'clock when the state set up regional nursing home hubs to take in elderly COVID-19 patients. The goal was to provide places better equipped to care for them and keep the disease from spreading. But a Target 8 investigation found many of the hubs have histories of bad conditions, poor care, and hefty fines. Ken Kolker joining us now with what he's uncovered. Ken?
Now, while some of the 21 nursing homes selected as hubs are highly rated for their care, 15 have faced a total of more than $1 million in fines over the last 3 calendar years. Among them, Skilled Muskegon, which was fined $350,000 3 years ago, before new owners took over. But it still has a below-average overall rating by Medicare and a much below rating for its record of inspections. The state paid it more than $250,000 up front to turn nearly half its beds COVID only.
I mean, it's just like sending death in.
Also among the homes the state designated as a hub, Metalodge of Grand Blanc, where conditions were so bad that Medicare has labeled it a quote-unquote special focus home. The state paid the Genesee County home $135,000 up front for COVID beds, though the state recently decommissioned it as a hub.
If the evaluations coming back from the federal government are less than sufficient, why would we want to put COVID patients in these places? Why would we allow this?
The state paid $3.6 million up front to 21 COVID hubs across the state for 715 beds. $5,000 per bed. The state also agreed to pay the homes $200 a day extra for their care. Target 8 went through inspection reports for all of the hubs, finding inspectors had written them up for a total of more than 1,000 deficiencies. Medicare rates nursing homes on a scale of 1 to 5, with 1 being worst. 10 of the 21 scored either a 1 or a 2, below average or much below average.
They scored so terribly in terms of caring for patients prior to COVID, then why were they still operating? Why were they still caring for other people's loved ones?
3 of the homes, Metalodge of Frankenmuth, Advantage Living Center Wayne, and Advantage Living Center Redford, got a total of nearly $500,000 up front, despite having the lowest possible Medicare ratings, much below average.
Why do you think the beds were open to begin with? Because they're not delivering the services.
The State Department of Health and Human Services says it chose hubs based on their willingness to take COVID patients, how close they were to hospitals with high COVID counts, their ability to isolate patients, and their performance history. Critics said that it put existing residents at those homes at higher risk. Denise Erickson's 90-year-old stepfather died with COVID at Skilled Muskegon before it became a hub.
Why would you send a COVID patient into a place where people are already having serious medical conditions?
The new owners of Skilled Muskegon, a company called Illuminate, say that they're living in the shadow of the former owners who filed bankruptcy. They say that they've improved care and conditions and are well equipped to care for COVID patients. They point to their 5-star rating for quality of resident care. The state says there's no evidence that imported COVID patients have infected others in the hubs. They say hubs are required to take extra precautions, separate wings, separate staff, separate meal service. In a Senate committee hearing in May, Michigan's director of the Department of Health and Human Services defended the hubs.
This is a world without perfect solutions. The solutions we've come up with, I think, aim to provide strong protections for provide the care that COVID-positive folks need.
The hubs have reported taking in more than 1,200 COVID patients from hospitals and from other nursing homes. Records also show that 219 residents have died of COVID at the hubs. Among them, Lynn Shearbeek, who caught COVID at Samaritas Lodge in Grand Rapids before moving to Skilled Muskegon. She died July 2nd. She was 80.
It was a COVID hub.
Her sister, who did not want to be identified, says that she didn't know about Skilled Muskegon's low ratings.
You couldn't refuse it because that's what they said they had to do.
The state recently decommissioned nearly half the hubs based on quote-unquote patient volume. But even some that remain have questionable records, including 2 of the lowest rated homes and Skilled Muskegon.
That doesn't make any sense. for them to send other people there when they aren't taking care of what's there.
Her son, Scott Carpenter, was 60 when he caught COVID and died at Skilled Muskegon before it became a hub.
He was just a delightful young man, never bothered anybody.
He had been there nearly 2 years since suffering a head injury.
Were you happy with the care he got there?
No, I wasn't. I felt that I had to ask 2 or 3 times for them to change him because he had bladder problems.
She says she called the home 5 times, hoping to learn more about his death, but nobody called back.
I thought they at least would tell me how it was at the end, that I do not know who was with him when he died.
Now, Senator Lucito's legislation to stop sending patients to hubs and to open COVID-only centers has been passed by the State House and Senate and is awaiting a decision by the governor. Now, for details on the hubs, we have a complete list on our website.